Hello everyone and welcome back to my channel, Conversations with Maya. I'm Maya. Today we're going to talk about teen suicide. February this week is Teen Suicide Prevention Week. So we're going to talk and discuss a little bit about what are the reasons teenagers could be taking their own lives, and also what can you do as a friend, mother, brother, sister, I was gonna say colleague, if you just know of anybody who is struggling with depression, probably that may be causing suicidal tendencies, then please listen up. Right. So, according to the World Health Organization, one of the top 5 leading causes of death amongst 15 and 19-year-olds is suicide. So we're seeing an increase in the number of teen suicides as the years are progressing. And one of the leading causes of this, the leading causes of 15 and 19-year-olds attempting to take their own lives, is because of depression. You find yourself that 15-year-olds and 19-year-olds, they're dealing with a lot, family, school, also their self-identity, trying to figure out who they are in the world, and sometimes it does get a little bit stressful. And when we're stressed out and we're not having good coping mechanism skills or any sort of support, anybody to talk to, then that could lead down to a road of depression. So if then you are wondering, like, what exactly is depression? How will I know as a 15 or 19-year-old, or maybe even younger, 11, 12, 13, that you may be down and depressed? What are the signs of depression? So first of all, you're going to have a loss of interest. Things that you used to like to do, you'd stop doing them. So if you enjoyed sports activities, dancing, you'll find yourself withdrawing from those things and you stop doing them as much as you used to. There's going to be a decrease in appetite, meaning you don't eat at all, or there's going to be an increase in your appetite, meaning that you're eating too much. There's also going to be sleep disturbances, meaning that you're either sleeping too much or you're sleeping too little, or you do get to sleep but you're restless and you're up every 2-3 couple of hours and you're not getting restorative sleep. You're going to feel, obviously if you're not sleeping well, there's going to be low energy and you're going to feel fatigued, tired all the time. So you'll always also experience low mood. You'll feel sad most of the time. If previously you felt sad once or twice in a month, this time you'll feel sad maybe once, 2 or 3 times out of the week. So your mood just becomes a little bit low. Also, there's experiences of hopelessness and helplessness. Another sign of depression would be a difficulty making decisions and isolation. So then, what could be the causes that 15 to 19-year-olds take their own lives? So we already discussed depression. Another one is alcohol and drug abuse, all right? You'll see a lot of children start experimenting with alcohol and drugs, weed, your MDMA, just experimenting. And those things can also exacerbate depressive symptoms, and it also can cause you to be down and depressed. And it can also cause you to have suicidal ideation, even if you haven't been experiencing any sort of depression. So alcohol and drug use is really, really quite dangerous to our teenagers. Another big one is bullying. Bullying is one of the biggest factors that we see affecting children, and how they become down and depressed, and how they have suicidal thoughts and suicidal ideation, the thinking about it. Abuse from home, physical, mental neglect, those type of things. Bereavement, maybe a loss of a mother, friend, sister, somebody that they were really close to. Or trauma, any sort of trauma, witnessing mom being beaten up by dad, or being abused themselves as well. Now, I'm sure there's a lot of materials on teen suicide and what causes teen suicide, what is depression, and how can it manifest in an individual. But I want to talk about how can you at home, mom, sister, brother, colleague, anybody who you know may be struggling with depression or maybe feeling suicidal, and you want to support them but don't know how. So how can you talk to somebody that may be feeling suicidal? First things first, stay connected to the story being told. We don't want you to be on the phone. We don't want the TV to be on. You don't want you to be distracted by a kid or whatever else. Stay connected to what the person is telling you because they want to feel heard, isn't it? The next one is help them stay calm by speaking softly and taking deep breaths together. So sometimes when somebody's feeling suicidal, they're feeling down and depressed, they may also experience anxiety and may also experience some panic attacks, right? So speak to them calmly, softly, and also help them with breathing exercises. Make sure that you are in a place that fosters a deep conversation. Now, I can't be at Wimpy, KFC, or whatever, and my friend is telling me that they're feeling suicidal. How can I be connected and stay with that person's story? Maybe if you're at a home or in a car and it's just the two of you guys, then that will be a little bit better. But very important to don't start a conversation, such a deep conversation, in a environment that's not going to foster the person feeling down and depressed to actually express more. You can start the conversation by saying, hi, I've noticed that you haven't been well lately. Like, are you okay? Is there something that you want to talk about? You know, in that way, the person is saying, oh, okay, somebody is actually noticing me and noticing a slight difference in me. And then maybe that person cares, and that could make the person feeling depressed or suicidal want to open up a little bit more. Also, give them time to share at their own pace without judgment. It's going to take a long time for them to be able to say their negative thoughts and their negative feelings out loud to another person because they have a fear of being judged. So allow them to speak at their own pace. All right. And then also check in often with them, all right, just to see if they're struggling or they're coping. If they are struggling and the struggling does continue, find help together. Reach out to a counselor, reach out to a psychologist, go to your local clinic, go to your local community clinic and ask if they provide any mental health services. Also, listen, ask questions, and try to understand what they are dealing with. This is not about you in this moment. It is about them. They are giving you an opportunity to step into their world. So put yourself in their shoes and try to listen and understand from their point of view without judgment, please. And then another one would be asking them directly, do they have any thoughts of harming themselves? Do they have any plans of harming themselves? Do they think of taking their own lives? Ask them directly. Do not be afraid. And I think most of the times as parents, maybe we're afraid to know the answer. Better to know the answer and go seek help than not knowing the answer. I hope this video has helped at least one person who is struggling with depression or having suicidal ideation. I also hope that it has helped family members, friends, on how to show support and how to talk to somebody who's feeling down and depressed. But remember, it does take a village. So if you feel like you don't know what to do, it is okay. Go to a local clinic and ask for mental health or counseling services. Thank you so much for listening to my video. Thank you for supporting Conversations with Amaya. And I hope we get to have more conversations moving forward. Thank you.